Corey Maas on Looking Your Best, and I'm very glad today is May 24th. Coming back from the meeting in Cancun, which made the New York Times, of course, interestingly, where we did have an advisory board meeting in the morning and 20 experts from around the country talking about the new botulinum toxin type A on the block, which is called Jeuveau, and that's hashtag Newtox is what they're going with. And I'll talk about Jeuveau because the company Evolus contracted with us 4 years ago now, and we were part of the clinical trial, the EV-001 study, in which 246 patients and 2 separate studies were run at the same time, 492 patients I think in total, looking at the product. And this is really Botox 2. I mean, it's the same former president of the Allergan Botox division and the directors of marketing that are the chief operating officers of the company. Excellent, very smart, capable people. And they've got a license from a Korean company actually, so the toxin is actually manufactured in Korea and is purified, and it's 400 kilodaltons, the same as Botox, and it's really, from our experience in the trial, Botox number 2. They have shown data on their studies looking at this and sort of overlaying botulinum toxin side by side, and 3 or 4% difference at dated endpoints, 1 month, 2 months, 3 out to 5 months, where I can't remember the exact numbers, but 4.8% of people were still responders, meaning that they had moved 1 point on a 4-point scale of wrinkle severity. So you can imagine how subjective that is, and about 2.8%, I don't remember the exact numbers, but about a 2 or 3% difference at 5 months of people responding. Most people, the botulinum toxins do not last 6 months, they're 5 months. On average, when you look at 2-point scales, the number of responders at day 30, which is how they do the studies for all of these, at 30 days after treatment, the percentage of responders that move from 2 points, either moderate to none or from severe to mild, that is what the FDA considers a responder. I think it's much more important when people move from either moderate or severe to mild or none. That would be the better gating threshold. But the bottle's like this, and there's a high comfort level that we have with Jeuveau, and so I get to treat my practice manager with it, which is my first non-study patient, as we've done 300 or 400 treatments already with the product in the FDA clinical trial starting 3 or 4 years ago. So with the Jeuveau, which is again botulinum toxin type A, and this is for providers and for patients really. Botulinum toxin type A still is the same mechanism of action. It blocks the signal between the nerve ending and muscle by inhibiting the release of acetylcholine packets, which are the neurotransmitter, into the neurosynaptic cleft. That's really a big mouthful. But in my patient right here, who is an experienced Botox user, we're going to treat her in the normal way that we treat the furrows, and we can do a little bit in the crow's feet if she desires.
Yes, please.
She desires, so we'll do those 2 areas. And the nice thing about reconstitution with 100 units, again, this is probotulinum toxin type A, is really, in terms of its performance characteristics, to me, it's just Botox number 2. There's 2 other products, Dysport, which has a little greater area of effect, and Xeomin, which doesn't have any of the complexing proteins, which is really very specific, has a very narrow area of effect, which in higher doses is going to give it a big advantage if they ever get to the studies completed. So in treatment with Jeuveau, we reconstituted. I do it with 2.1 ml to 2 ml of saline, and I'm going to do a 20-unit dose in the glabella. I like to grasp the brow. For those of you who don't like to see needles, don't watch this little pinch. And we'll do about 7.5 units in the medial club head, and then I'm going to come out here laterally, pinch, and then do about 2.5 units in the lateral brow, and you just see one little tiny drop of blood. And not too much pressure. If you see a little drop of blood, that's really all you'll ever see. I mean, that at most with any of the patients is just a little drop. And of course, she's been taking Advil because she's had headaches. So we're going to treat the headache that she's got now. Actually, in the study, interesting. Same thing on this side. The headaches were looked at because it was a side effect noted with some of the other botulinum toxins, and it was the same pinch as placebo, which really, in my mind, proves the theorem that people who get headaches after treatment with any of the botulinum toxins in this area are probably getting it from the needle trauma itself, stimulating headache. And a little couple drops for the Proceris there. And so that's a 20-unit application in the glabellar region, and she looks very good. We can zoom in. People get a little bit of swelling. You can see little mosquito bites there. Even with a bunch of non-steroidals, she was taking Advil for headache, like I said. You shouldn't really see any bruising. And it's the same. I've done a lot of these for crow's feet. I'm going to turn your head just a little bit to the right here, to your left. And I'm going to lift the brow, look for any little tiny vessels. And we want to develop little tiny wheels just below the skin surface. I've heard people describe this as intradermal, but it's really not intradermal. It's subdermal, and that's really going to treat the corrugator. And I published that paper 10 years ago now almost. This is a very powerful brow depressor, so if we relax the muscle that's pulling the brow down, the brow will naturally come up. So we get up to a 5mm lift. And that double-blind study that we did looking at brow position in the pinches. And I'm avoiding bruising by looking for little vessels around the lateral canthal lines. And we'll get maximum brow lift if we do that. And so now you've seen a treatment with Jeuveau, the Newtox that's out there. I think it's number 2 botulinum toxin, and it sits there amongst the others as they're sort of twins almost, I think, Botox and Jeuveau, and with the 2 bookends being really specific, that very focused treatment with Xeomin, and the little wider area effect treatment with Dysport due to the complexing proteins, which we're learning more about. If you have any questions about Jeuveau, call us, visit our website at maasclinic.com, or you can always write me and send photos at our video blog, drmaas.com. This is Dr. Maas.